Hey, what's up, everybody? Dr. Mike here. You know I'm all about giving you guys the information you need to live your healthiest life. And today we're focusing on Europe. We're going in depth on the top 10 major health challenges they're facing right now. And guys, these aren't just statistics on a screen, these are real issues affecting millions of people. We're talking about everything from the silent struggles of mental health to the long-term shadow of COVID-19. So if you're ready to get informed and understand the state of health in Europe, stick around, let's break it down. First up, we're tackling the often invisible crisis mental health. Guys, the numbers are concerning. Across Europe, we're seeing a surge in depression, anxiety, and other mental health disorders. Think about it. Economic uncertainties make people stress about their jobs and their futures. Social isolation leaves people feeling disconnected and alone. And the pandemic? Let's just say the aftermath of COVID-19 really shook things up when it comes to mental well-being. It's a perfect storm, and it's taking a toll on people's mental health. But here's the thing, mental health matters. It's just as important as physical health, and we need to break the stigma surrounding it. Next up, we're talking about heart health, or rather the lack thereof. Sadly, heart disease and stroke are still major killers in Europe. And you know what's even crazier? Many of these cases are preventable. Lifestyle choices play a huge role here. We're talking about things within your control. Poor diet, lack of exercise, smoking. These are all major contributors to cardiovascular problems. Remember, taking care of your heart isn't just about adding years to your life, it's about adding life to your years. Let's talk about another growing concern, obesity. Now, I know this is a sensitive topic, but it's a conversation we need to have. Europe is seeing a steady rise in obesity rates, and this isn't just about fitting into your favorite jeans. Obesity increases the risk of serious health problems like type 2 diabetes, high blood pressure, and metabolic syndrome. It's a domino effect, and it's impacting people's health and well-being across the continent. Chapter 4. Here's the reality. Europe has an aging population. People are living longer, which is fantastic, but it also means we're seeing a rise in chronic diseases. Conditions like dementia, Alzheimer's disease, and arthritis are becoming more prevalent, and this puts a strain on healthcare systems. We need to find innovative ways to care for our aging population and ensure they have access to the resources they need to live their golden years to the fullest. Chapter 5. Let's clear the air and talk about respiratory health. Air pollution, smoking, these are major culprits when it comes to respiratory problems. And guess what? COVID-19 has thrown another wrench into the system, leaving many with long-term respiratory issues. We're seeing higher rates of asthma, chronic obstructive pulmonary disease, and even lung cancer. Protecting your lungs is essential, and it starts with being aware of the risks and making healthy choices. Chapter 6. Cancer. It's a word that strikes fear into the hearts of many. The good news? We've made incredible progress in cancer care and screening. The not-so-good news? Cancer remains a major health issue in Europe. Lung cancer, breast cancer, colorectal cancer, prostate cancer. These are just a few examples of cancers affecting a significant number of people. Early detection is key, and so is understanding the risk factors and making healthy lifestyle choices. Chapter 7. Infectious diseases, a constant threat. We live in a globalized world, and that means infectious diseases can spread rapidly. Europe faces challenges from seasonal influenza, antibiotic resistance, and occasional outbreaks of diseases like measles, even though vaccination rates are relatively high. It's a reminder that we can't take our health for granted. Vaccination, good hygiene practices, and being mindful of potential outbreaks are crucial for protecting ourselves and our communities. Chapter 8. Health inequalities, a matter of justice. Here's the truth. Not everyone has equal access to healthcare and resources, and this leads to health inequalities. People from marginalized communities, low-income groups, and those with lower levels of education often experience worse health outcomes. This isn't just a statistic, it's a matter of social justice. We need to address these disparities and work towards a future where everyone has the opportunity to live a long, healthy life. Chapter 9. Substance abuse, a complex issue. Substance abuse, whether it's alcohol or drugs, is a complex issue with far-reaching consequences. It affects both physical and mental health and has social and economic implications as well. Addressing substance abuse requires a multifaceted approach. Prevention, treatment, and support are all essential. It's about understanding the root causes, reducing stigma, and providing help for those who need it most. Chapter 10. Long COVID. The pandemic's long shadow. Finally, we can't talk about health in Europe without addressing the elephant in the room, COVID-19. While the acute phase of the pandemic may be behind us, the virus has left its mark. Many people are experiencing long-term effects known as long COVID. Fatigue, brain fog, respiratory problems, these lingering symptoms can be debilitating. We need to continue researching long COVID, providing support for those affected, and prioritizing vaccination and public health measures to prevent future outbreaks. Outrow, stay informed, stay healthy. So there you have it, the top 10 health issues impacting Europe right now. It's a lot to process, but remember, knowledge is power. By understanding these challenges, we can start making informed decisions about our health and advocating for better healthcare systems. If you found this video informative, give it a thumbs up and share it with your friends and family. Let's spread awareness and work together to create a healthier future for everyone. Don't forget to subscribe for more videos on health and well-being. Stay healthy, and I'll see you in the next one.